Okay, Assalamu alaikum, everybody. How is everybody doing today? I am your host, Dr. Hamza Farouk. We are just waiting for a couple of more people to show up. I hope everybody can hear my voice. Uh, today, what we're gonna do is sorry, I was having back replay. Everybody can hear me, right? Just write in the comments section if you can hear me. Okay, I guess we're still waiting for people to show up then. A little intro about myself. I am Dr. Hamza Farouk. I am the co-founder of Excemy Medical. I am a international medical graduate from Dow International Medical College. I am currently residing in Dallas, Texas. And today, Dr. Mohsen asked me to fill in today. We're going to keep it light. We're going to keep it interesting. I'm going to try to answer as many questions as you guys can give me. The main topic is about USMLE, which we will start when more people show up. And then after that, I'm going to give you guys a couple of advice about medical student life advice, the struggles that you guys go through on a daily basis, the amount of like how to prepare, how to study as a proportion for that. The one thing that I want you guys to know is that when we start studying for the USMLE, many of my seniors did not tell me about this advice. They were all like, when I started medical school, right? The first proud moment of your life is entering med school. It's entering those first corridors. And then after that, everything becomes a reality to you. But the most important point is that when you're in your first and second year of med school, you should be prepared to understand every concept that you learned. A lot of people didn't tell me because I used to be a student that used to just memorize stuff, but memorization does not help you afterwards. I see we have more people joining. Just write in your comment section of who you are, what med school you're in, and if you have any questions throughout the session, I'll be able to help you. So as I was saying that the most struggle that I found is that in my first year of med school, I was just memorizing stuff and that did not help me at all, Not even the seniors told me is that when later on, even when you become a doctor, you need to be able to understand every basic concept that you're doing, right? Let me give you an example. If you're working out, if you're going to the gym, right? In the first day, in the second day, you're going to be like, oh, okay. Maybe to yourself, you're going to be like, oh, I'm seeing some progress, right? You're going to look big, you're going to look bulky. But if a third person notices you, maybe like after 3 or 4 months, then they'll be like, oh, you actually showed process. That's how med school studies is. You have to be shown process. You won't get it like at the first time, right? You have to know your basic sciences before you get to the clinical stuff. And that's what the first 2 years of med school is. That's what the USMLE wants to check on you. I know that now USMLE has become a pass or fail. By the time that I took it, it was more of a scoring struggle. But now that it's become a pass or fail, a lot of international medical students are going to start applying. All right. And the thing is, now there's going to be an influx because you can even take the USMLE, like what's the passing score? It's like probably 195, right? You can take a passing score of 195 and all you have to do is actually study for step 2. That's what they're going to be basically looking for. So let me just tell you this is that I was going back to it that when I'm studying for med school, when I'm understanding every basics concept behind it, whether it's pathology, whether it's physiology, it all goes and becomes connected. Eventually, when you're studying for a clinical diagnosis of that, you are going to learn what that is. Number one book. I feel like everyone already knows this, but when you're in the first year of med school, you should have your first aid ready. All right. A lot of seniors did not tell me this beforehand, so I'm telling you guys this because for me, look, Excemy Medical is here. I'm here, but the thing is, all your life, you're going to be a teacher and a student. Even if you become a doctor, it's a whole cycle. You're going to teach, you're going to study. And that's what everyone should try to do as a community, right? You should be able to teach everything you've learned, every struggle you have, and pass it to the people that come after you. There's no competition when you're a doctor. You basically have one simple goal, and that's to helping people and to understand every concept behind it. Let's get back to step one now. So Usmle step one is all basic science. What do you want to learn about it? It's an 8-hour exam. Yes. Basically, it's divided into 7 blocks, each with 40 questions, roughly so, in each block. And you have around 60 minutes to solve 40 questions in an hour. And the basic advice I can give to you is practice as much questions as you can. Even if you're in first year or maybe second year, start doing like 20 questions a day. Where do I do questions from? There's NBME as well, but I wouldn't recommend taking NBME until after you're ready. UWorld, in Pakistan, I know they have UWorld books, which are way cheaper, but they actually have the questions. Not even 20 questions a day, do 10 questions a day. You're going to learn something, right? You're going to retain some knowledge. And that's what the step one tests on you, is how much you can retain it during the first 2 years of medical university. And then once you have that solved, right? Once you've understand that whole concept, what are the major books that you can learn? I'm going to tell you, obviously, first aid is a major book. Do take your advice on step 3. I mean, not step 3, but do beforehand, make sure that in your third year of medical school, that if you're ready, go ahead and take it. Take the first 2 years to just learn what you're learning in med school, right? Then on the third year, you can take the Usmle step exam. It doesn't matter. I see a lot of people joining now, and that's very good. If you have any questions about who I am, what I do, again, I am the co-founder of Excemy Medical. I am a medical graduate from Dow University Medical College and Dow International Medical College. And I am also, residing here in Dallas, Texas, and trying to give you all the advice I can from what I've been through, right? But we are going to keep this as a discussion for everyone to make sure that, you guys can ask me anything you want throughout this session, and I will tell you the struggles that I've been through throughout the exams, throughout med school, and what you guys should be doing. So back to step 1, right? A quick review is that, okay, I've given you the layout of the step 1 exam, right? Now what we have is, what books do you learn from? Obviously, you use the books that you're already learning in med school, right? You use Guyton and Hall. You use Biochemistry, Lippincott. Those are the big books that, some people don't understand. But once you get to the review period, I'm going to tell you that if you're if you've done your 2 years of medical school, and if you're in your third year of med school, and if you have time, do take Kaplan courses. I know a lot of people don't recommend it, but they are helpful during step 1. Even though it's a pass or fail, especially if you're in Pakistan, they are going to help you connect connections of each subject. Even if you haven't learned it in your first 2 years of med school, it really helped. And I'm pretty sure you guys would like it a lot. After Kaplan, another resource that I've learned to live with is Boards and Beyond, right? Boards and Beyond videos are very helpful. They are high yield. They will tell you everything that will be on the exam. And now that it's been pass or fail, you can go through it quickly, okay? You can learn the material, you can understand it, and maybe you can even take it in like 2 months. So, because you need only like a 195, maybe a 196 to pass, and it's not that bad. Other resources are, these are extra resources that some people use. How many people have used Sketchy? How many people are visual learners here, right? I'll tell you this, for me, myself, I'm a visual learner. Until I don't imagine things in my head, it doesn't help. Like if you see behind me, bunch of sticky notes. Those sticky notes are helpful to, make me understand it. I need to have a clear image of what's going on, and Sketchy actually helps. It makes up a fun cartoon. It makes up a, a fun image for you to easily understand that point of view. It's really helpful. In pathology, obviously, clear option, pathoma. All right, I have never used any other. Some people have used Golgi. Golgi is fine, but some people don't they don't, it doesn't make it clear to them because they think that it's too much info. That's okay. Pathoma will get you covered in that. And Pathoma videos, Dr. Hassan Sattar, they are the best videos that you can ever watch for pathology. But again, Kaplan actually helps you with all of that. Besides that, there are other resources, but everything else is just extra stuff. You don't need to do those extra stuff until you've covered the main things that you need to do. If you're going by first aid, do like 10 pages a day, maybe 5 pages a day to see if you actually retain the knowledge. Everything you learn throughout the day, make sure you have enough time at the end of the day to just make sure you've covered everything you've learned, because that's important. Retain the knowledge that you've learned. If you don't understand, go to somebody else, go to a senior, go to there's Dr. Mohsen and I, go to someone who knows, who's been a doctor, who's doing residency. They will explain it to you. I know that when you're in first year of med school, a lot of people are also shy, they're quiet. They don't really go to their professors. I would disagree on that part. I would say you are there to learn. You are there to make yourself a better doctor. You are there to be the best you can be. I encourage everyone, that if you're retaining knowledge, make sure it sticks with you, because in the end, when you're actually diagnosing a patient, when you're actually making sure what the treatment is, you are going to use that basic knowledge behind it. Obviously, when you go back to it, you're going to forget some stuff, but you will get there. And all of this is, like I said, practice and learning. If you're in med school and you're practicing, like if you're going to the gym, like my previous example, you won't build a body, you won't have a six-pack right away. You are going to build it, after 3-4 months of, training, after maybe 6 months, when you add on more weight, when you're doing as many reps as you can. That's the same for medical studies, right? You're making sure you're perfected that knowledge. You're making sure then you add more knowledge into it. That's perfecting is knowing your basic science, and then adding more weight to it is the clinical knowledge. That's all there is. So that is how you became a better doctor. Now going back to the USMLE, step two. Step two is the major score they will be checking nowadays. If you're applying for residency, that is where they are switching. You need to have a high step two score. And I think in June or July, they are raising the score, the subtotal score standard. I'm not sure what it is right now, because I think they will list that in June or July, but step two CK score needs to be high, because you are going to be competing with everyone else. And another thing that came to my mind is, I hope I'm not talking too fast for everyone. Again, stop me again if you have any questions, whether it's in med school, whether it's in residency, whether it's in, CV and research that I'm going to talk later on about. Nowadays, what I was saying is that in residency, they are going to look at your step two CK score. And because step one has become pass or fail, you're going to have a lot of competition set in. Besides that point is, this also brings me to a point, is that, look, a lot of people ask me that, should I, start doing electives? Should I do research and all that? I would say yes, do it. But all these extracurriculars, they are icing on the cake. You need to have a high score before they look at everything else, right? Before they look at anything else, you need to have a high score, because that is where they're going to set your application apart. They're going to look at your step two score, and they're going to be, all right, a step one score. And they're going to be like, all right, let's set this apart. And then they're going to look at your extracurriculars. And besides the point, after you've taken your step two, and between the time you apply for residency, you have enough time to do electives, observerships. Obviously, when you graduate medical school, you are going to do observerships rather than electives, because electives happen during med school. But besides the point, you have enough time to do that. You can do research in even your final year. Max, they're gonna look at, 2 researches, 3 researches. That's it. And if you have a high step score, and they're just gonna be like, oh, he's done a research. All right, we'll bring him in. If your application says you have a high step 2 CK score and another person has just a little lower bit of it, but he's done more researches, they are still going to take you, because that's what they're looking for, is that if we bring you to the hospital, will you be able to do your job? And that's what the step 2 CK score does test knowledge on. What do you recommend between plab and Usmle? That is a very good question, Anas. So me personally, I've always told people this, is wherever your family is, wherever you want to reside, that is where you should take it, and you shouldn't lose hope on anything. Like, my roots came from, United States. I eventually had to go back from Pakistan to the United States. So that's why I chose the Usmle option. But there are people that, if you're in Pakistan itself, you have 2 options. That's great. Plab, I have heard, is my personal opinion is this, do not quote me on this, but plab is easier than the Usmle. That's why people go for it more, and a lot of Pakistani students have gone for plab because they are offering more residency options as well. So that's why people take it. Usmle is a bit harder, but as I can tell is that if you're gonna study all the way. I've known people who've taken Usmle and plab. They've had a lot of time to do it, but they've taken both of them. So it is where you want to eventually reside. If you want to go and take plab because that is easier for you, you can go for that. If you want to take Usmle, you can go for that. But the main thing is that you have to study for both of them, right? You're going to study the same amount you study for Usmle as you study for plab. It's also like where you want to be set up, because I know visa option is better in the United Kingdom than USA. Because when you're applying for residency in the United States, they do look at your visa options. Those are the 4 things. There's like 4 things they look at. It's they will look at where you went to med school later on, but they will look at your step 2 CK score. They will look at your transcript at the end, and they will look at, okay, your visa options. Like, is this person capable of coming here to the United States? The worst thing that they do ask you is because when someone is applying for visa, because another person has asked me this question before, is that you just have to reassure them, because after you're done with your job, you will go back. But that's totally up to you if you want to stay after your residency or you want to come back, also up to you. What is the budget? Oh, that is a tough question. What is the budget requirement for Usmle exams? A lot of students are confused about this. Okay, so for me, I will tell you this, it is a lot of money. Kaplan courses aren't cheap. They costed me around $3,000 to $4,000. 4,000 to be exact, around that range. Then you have, you have your application for each Usmle exam. It costs about like $1,000 to take it. After that, if you're doing electives as well, electives is like, if you're doing it from a program, that's another $2,000 over there. So total budget, I can't guarantee what it would be, because it also depends on, how much research and everything you do, but do expect like $10,000 to go out of your budget. It's tough. It's tough. It's not easy, because I've known med students here in the United States. This is why they're in med school debt. We are the most people in our career that spend a lot of money to get the education we need, So it's a lot, like 10,000, maybe even more for some people. I would recommend the budget amount for that. Let's talk about, all right, what was that? Okay, step 2. Step 2, what do you want to learn about step 2? it's a 9-hour exam, compared to step 1, it was an 8-hour exam. Step 2 is a 9-hour exam, and you only have a 45-minute break. 15 minutes is tutorial, and you can choose whether you want to do tutorial or not. It's up to you, but 45 minutes is break time, and you get to divide those break time, right? You need to time yourself, because if you're taking like 2 blocks and then you got to say, okay, maybe I'll divide it by 10-minute break and then do 2 blocks and 10-minute break, or maybe you want to do 2 and then 20-minute break, and then on your last, blocks, you just want to go for it. I would recommend, whether you're taking step 1 or step 2, do take a diagnostic test. That will tell you how much knowledge you have and where you are. It will tell you about, like, okay, these are the subjects that I'm weak in. I need to prepare myself more on it. And that's where I'm going to go. Then after that, I take maybe, once I start like my main period, I take like 20 questions a day along with the subjects I need to study. Then I boost it up to 40 questions a day. And then when I'm in my final 2 months, NBME exams. Main 2 questions options I will give you. Yes, there are Mbbs, there is osmosis, there are other study materials out there, but these are all extra stuff if you need it. Do I recommend using the latest version of first aid every year? So I would recommend use the latest version of first aid this year, because it did turn into pass and fail, and there is a lot of communication subjects on there as well. A lot of ethical questions on the exam as well that they have boosted. So it depends. Like, yes, for this year, I would get the latest version of first aid because it is very different from last year's version. And if you want to do it every year, yeah, you don't want to take the risk. I would do it, and let me let you in on a little secret. A lot of people because I was in this, I guess, WhatsApp group when I was studying with Kaplan, and there's a lot of people that would send out the latest versions using PDF files of it. So they would save a lot of money on it, and the PDF versions of first aid were out everywhere. Um, in Pakistan, I'm pretty sure you can get it anywhere, but yes, I would recommend using the latest version of first aid. Pathoma, though, it's the same every year. I wouldn't recommend buying that same version every year, but yes, first aid, please do. Back to what I was saying is that step 2, okay, 2 things that you need to know is, do you use UWorld, and do use NBME as well. The rest are optional. I know I tried Mbbs. Mbbs is a bit more detailed, but it does help you. Osmosis, I love osmosis videos, but these are all extra. I didn't have to do these extra stuff when I was studying for step 1 or step 2. It depends on how much you can retain and how much you understand. It totally depends on you, and you won't know until you practice and start, learning. When should I take step 2? Obviously, take it. Look, a lot of people take it in their final year. All right. A lot of people take it after they graduate. You have enough time. Once you graduate, you have enough time to take step 2, CK, before you apply for residency. Because I know in the United States, residency applications open in probably around, I would say September wise, EROS opens in, but by July, they start bringing in the process. And then you get your interviews around December, maybe November. It depends on the medical universities that you've applied to in the match. Can I guide about ECFMG? Yeah. What's there to guide about ECFMG? Obviously, the whole new website has been changed, so it's another thing. Once you go to ECFMG, you click on IWA, which is the web application. You apply, you sign up, and they send you a USMLE ID, maybe in 3 to 4 days, maybe a week, depends. After that, once the portal is open for you, then you click on, I think, information, our application to USMLE. You type in your USMLE, you make sure that you either click you are a medical student while taking the USMLE exam, or that you have graduated when you're taking the USMLE exam, because those applications are totally different. Okay. What things will they require? They will require about your university, right? Because your application goes through a portal to the medical university you have. Make sure the medical university that you are attending, I know Dow and Al Khan has, they are, in the International Medical Web Directory. They are applied through the US ECFMG. They are in the program as well. Because a couple of my friends in the Caribbeans, they did go to medical university, but they weren't, applicable in the ECFMG. So they switched to a different medical university that was when they were applying for residency. Another thing is that, okay, once you've set that up, it will tell you about, like, if you graduated, what wards did you take? It will try to list that all out for you. And then there will be another application where it will say, okay, this is the form, I think it was form 180, where they're gonna bring you online, they're gonna take a picture of you, and they're gonna notarize you. Once that notarize has been completed, and once you applied for USMLE, it will ask you about the fee. It asks you about the fee beforehand. You pay through it online, and then that application gets sent to your university. And then your medical university approves it, make sure that you're a medical student or that you have graduated. They send it out back to you, and then it gives you like an email that yes, you have been applicable for the USMLE Step 1 or USMLE Step 2, and then you pick your dates, which you've already picked. It has a 3-month eligibility, right? So let's say you want to take it from anywhere from January to March, right? You pick 3 months, January, February, March, and you already put it on the application. After it has been applied, then you go to Prometric. If you are ready during Prometric, you just type in your USMLE ID, you type in your login information, and then you click on the date that you want to take the exam. Once that date is set, they will bring you on board to take, at the testing center. I know you can take the step. It doesn't have to be in the United States. You can take the step in Pakistan as well. You can take it in Australia, in US, in UK. They have different centers for that. Once that is done, then you're good to go. The application process is very lengthy. Sometimes your med school does get back to you after 4 to 5 weeks, sometimes 2 to 3 weeks. So make sure you are consistent in that. Make sure you badger whatever medical university you're in and try to, suppress them to tell you what's your application status. So do not, be lazy about it. Do not make it prolonged or anything. But what is the best video resource to pair with First Aid? First Aid has its own resource video, but do use Boards and Beyond. Boards and Beyond with First Aid is amazing. It correlates with the First Aid. It tells you everything in details. It tells you the high yield points, and you can easily go along with it in your First Aid book. Especially the new Boards and Beyond video, they are very great. I've had no trouble in understanding them. I know some people do. That's why I do recommend Kaplan as well. But I've had a very few people who had trouble with Boards and Beyond, but everything else is, amazing with Boards and Beyond. So do use Boards and Beyond with First Aid. Do you recommend studying from Kaplan books? Like I said, okay, so what I did is I didn't use Kaplan books. I used more of Boards and Beyond videos. I used First Aid books, and I used a little series called, the short pathoma books for physiology, BRS. BRS is helpful, but I know some people don't like it, so it's all on you. But if you are taking a class, I would just say go through the Kaplan book only once while doing class, and if you have time. If you're because you can take Kaplan online classes, right? And they give you a book reference because the professors that teach you, there's a very good pathology professor, Dr. Barone, amazing pathology teacher that lets you, build your concepts on it. A great biochemistry teacher as well, Dr. Salvatore. So Dr. Salvatore was amazing in connecting, because I know everyone hates biochemistry. If you don't hate biochemistry, I know you're lying. I know you're lying, all right? Everyone hates biochemistry. I did not personally like biochemistry, but he helped me build the concept from building blocks, and it was easy to understand. It would really help me in step one. So use the Kaplan books while you're doing the study lectures only once. Other than that, I wouldn't recommend it. Can we get a good job in other countries other than USA after completing USMLE? Yeah. Um, I mean, yeah, you can get another good job after completing. I know, I was talking to a couple of people that the United Kingdom has allowed applicants to come through if they have taken USMLE. So they are allowing more, doctors to come through even after you've taken USMLE other than plab. I don't know about other countries. Australia is you still have to take AMC exams to get in. The whole thing about it is that these license exam is to help you get residency, and every country has a different medical license exam to compete. Pakistan has NLE. I know a lot of people are taking NLE. Dr. Mohsen has completed NLE himself. He's posted about it. That's been freshly new. Australia has AMC. After you do the medical exam for them, then you get residency in Australia. Same thing with US. After completing USMLE, you will get residency in US. But UK is the only country that I know that is, completing, that is allowing doctors or residents that have done USMLE to come get a job. They are offering a job to you. That's why I think a lot of people prefer to go to the United Kingdom. That's my other point that I want to bring up, is that, let's say, of electives and research, because I know someone is going to bring it up eventually. And US elective is if you're an international medical student, or international medical student, it is great for you. It is amazing for you, because you get the experience. Because if you're getting residency in US, it's a bonus point. I mean, it's an icing on a cake, but it still will help you in the process. It's everything else, your GPA, your electives, your research, they are all icing on a cake. So if you get an elective opportunity, I would recommend after doing maybe third year, because you have some clinical information in third year to do electives. Other than that, you can do observerships, and you have enough time on that. And we have another question. Kindly tell visa process and requirements for USMLE. Okay. So personally, I have been a US citizen myself since the beginning, but I know people that have gone through the visa process. I know it's a tough process. The number one thing, like I've said before, that if you go to get visa at your local embassy, that you are applying for the USMLE and that you want to, take it in the United States, you need to have proof by Prometric. You need to be able to apply, have your application ready, and also contact ECFMG about your visa process, so that you have enough information to bring it when they actually call you up to the embassy. The number one thing that the visa, the people that sit for your visa, if they're going to accept it or not, is that they are going to ask you, is that, are you eventually going to come back? For some reason, they want you to come back. They don't want to have you stay in the United States for some odd reason, right? And you have to tell them, you just have to give them reassurance that you will come back, But by visa process, obviously, number one thing, make sure your application has gone through. Make sure you have signed up for Prometric. Before Prometric, make sure you have, taken your process through the local embassy, and they will give you a paperwork file, right? You have to fill it out, you have to file it through, and then I think, I'm not sure because I may think it might go through an F1 visa, because H1 visa is more of a jobs, if you're going for an elective, then an H1 visa will help, because elective or observerships hospitals will give you the visa right away to make sure you come back to come to the United States to work for like maybe 4 weeks, 8 weeks, and then they'll send you back. So that's on them. But when you're applying for the USMLE, you just have to give them reassurance that you're just coming to take the exam and you're coming back. Yeah, GMC is accepting USMLE given before March 2021. That is, if you don't know, GMC, that is in UK itself. But yeah, that's all there is for visa process. I know a lot of people that have been concerned about this. I know a lot of people that have been rejected. If you get rejected, then you can take the USMLE in Pakistan. You can just take it in Pakistan, and then when you apply for residency, have your visa information done. Then they'll bring you on board. Requirements for USMLE. Okay, like I said, on ECFMG website, a couple of things they will ask you is, where did you graduate, or are you still in medical school? They are going to take, let's say, if you are doing boards and clinical studies, then you need to apply to, what clinical observerships or clinical studies that you took, what wards did you take, and you need to write that whole information on. It's a big paperwork process, and you need to know like the dates as well. Make sure you look it up in your ward book on the dates you've started and the dates you've completed that. After that, they will ask you, transcript. They will ask you transcript. If you're a medical graduate, make sure you have your 7 letter of recommendations, and make sure you also have, the MSPE, the personal letter from your dean as well. They will ask you that. Dean's letter is important to make sure you have enough information on there. 7 letters, they will explain it to you after you graduate medical university. If you haven't graduated, then, it's fine. You can still apply for the USMLE during med school year, but make sure you do take it like during your, you take it in your 3rd year. I would recommend 3rd year to take your step 1. A lot of people did not tell me this, but that is my personal opinion, that do take it in step 1, and then you can take step 2 CK after you graduate. It's enough time for that. CS is currently suspended right now, but they may bring it back next year or the year after. I know people who are applying through this year's cycle, they will not have to take it, but people applying through the next year's, the year after cycle, they might have to take CS. Step 3. Oh boy, step 3 is optional. But what I would recommend about step 3 is that you can take it while you're doing residency, while you're working. It's easy. Okay, you don't have to study that much for it. You can have, it's just 1 book, just take the first aid for step 3, you're good to go. But what step 3 is that, they'll bring you in front of a panel, you perform. It's basically what you do in wards. That's it. But I know that because of competition, because of step 1 becoming pass or fail, you can, if you have time, take step 3 after step 2 CK. You have enough time, just take it. What's the worst thing that's going to happen? It's just an extra bonus on your CV. That's it. What is the difference between electives and observerships? Okay, so electives is only for students that are in medical school. Whether you're in 1st year to final year, a lot of medical school has a provision or like a guideline in sort that you need to be like in 3rd year to take an elective. But I would recommend that, take it in 3rd year as an elective. Observerships are for students that have graduated medical, medical school. But the only difference is that you do the same amount of clinical work. If you're in Pakistan, electives in the US is gonna seem different to you. It did seem different to me, the way they were asking, the way they were performing their wards, history taking, the way they were, going through the patients. It's a whole different system. So it is an experience that I recommend everyone to take before coming to the United States. Observership is the same thing, but you have more responsibility. Observership, they might ask you to, okay, they might leave you alone for a little bit. You just report to the chief resident, or you report to, the first year resident. They ask you about, okay, let's perform, do the CCG, read it out for me. What is it? They might ask you to do, you have an ultrasound. If you're in radiology, go to this person. If you're doing house job, then you know what to do in observership. But if you're a medical student and you're just starting out, then it may be a bit difficult for you. And that's why electives are there, for you to shadow the doctor, where they don't even give you that much work. But I know like some electives they do, but fair amount electives and observerships are somewhat similar, except observerships will give you more responsibility because they know you're a medical graduate. So they will bring more tasks on hand to you. Can we take date for USMLE exam before 6 months? Yes, Moise. Yeah, I hope I said that name right. But yes, you can. You can take it before 6 months. It's fairly simple. Make sure you select your 3-month date on the day you do take it. All right. But I would recommend is being, prepared as much as you can before you apply for the date, since it does take time. And if you're like a medical graduate, I would do it 6 months before. Does elective in Pakistan accepted in US? Yeah, they do accept it. Sorry, it took me a while to understand that question, Como, but they do accept it. The only thing is that if you're applying for US, they are going to more look at electives in the United States. They are going to be more eye-opener because their system is totally different than the electives you do in Pakistan. So if you do have a Pakistan, write it on your CV, write the elective on your CV, but also do one in the United States as well, so they will be like, oh, you have some experience here as well, huh? It makes our job easier for you. Because if it's in Pakistan, they're also going to think at the back of their head. And this is the reason I'm saying it, because a lot of my friends, cousins, family members, they have, they're completed residency, they're doing residency. A couple of my friends are doing residency. And, this is what I'm giving my advice on, is that, especially what I've personally gone through, is that yes, you want to be able to make sure that you have also an elective here in the United States as well, whether it's one, whether it's two, make sure you have it. CV, like what should be added to make our application stronger? Number one thing about CV, make sure you pass your step 1. Make sure you have a very high step 2 CK score. I'm talking about 260 range, 260 plus range, because now that step 1 has become pass or fail. Make sure you bring all your focus on step 2 CK, and you have that, because that is going to be an eye opener. Think for yourself. If someone is applying a job for you, you're going to look at their, score first, be like, oh man, this guy has a high score. He has more medical knowledge than these guys. I'm going to put his application on the side. The extra things that can be made to make your application stronger is electives / observerships. Make sure you have maybe 2 to 3 electives, maybe. If you have 1 to 2 and you have a high step 2 CK score, hey, it still works. Research is important. Make sure you have published papers. There are a lot of YouTube videos on how you can get research as well. The main thing that I had trouble with getting research, and no one actually told me about this, is that you do need to make connections. Connections is everything, especially if you're getting a research. Make sure that you have a mentor. You'll attach yourself to that mentor and, get that research, because that person will give you the next NRMP research and will get you the thing that they are working on. You can also go through NRMP. You can go to Mbbs as well, and they will give you a listing of research that is going on or that has been completed, but it will give you a doctor. Other than that, other than the electives, observership, research, GPA, they don't really look at it, but they will look at it towards the end. They also do look at visa applications. And the last thing that they do look at is make sure you have your personal letter. Make sure you have your transcripts. Okay. In transcripts, if you have a great transcript, I know it's a bit harder in Pakistan as well, but if you have a great transcript, that also works for you. But again, these are all extra stuff, right? Anything clinical you do, add it to your CV. Another thing, this is very important. When you are applying for residency, and here's a little secret I want to tell you guys, make sure you can apply to as many broad programs as you want. No one really told me this. They told me that if you're applying for, like, say, general surgery program, make sure your CV is suited for general surgery. You don't have to do that. You can have two different CVs, and you can have one that goes into, internal medicine and one that is specified to general surgery. And you don't, because they are not allowed to ask you during residency interviews that, oh, have you applied anywhere else? If they do, you don't have to tell them. All right. You can just be like, oh, I've just applied here. I've just applied to this program and my medical CV is only suited for this, right? You can apply to internal medicine. You can apply to family medicine. You can just keep your search broad, especially if you are, if you had a tough time, you're trying to get money. You want to start right away at your job and you don't care which field it is, apply abroad. Hey, if you don't get into surgery, maybe you'll get into a medicine program. A little secret with you guys. If there is a gap in your CV after house job due to prep time for Usmle, will it have a bad impression on your application? That is a very good question, Rida. Very good question. A lot of people have asked me this. If you are applying, if you take your step 1 or step 2 CK, make sure you take your step 1. Make sure it hasn't been more than a year in the process. Make sure if you're graduated and you're taking step 1, you do it under a year. All right. If it has gone for over a year of you taking step exams, then they might not look at your application, and that's a tough thing. It makes it harder, but you might get lucky in maybe the second or the third cycle, but do not give up. I've known people who have gone through the residency cycle maybe 4 or 5 times. They've been through a very tough time and they've eventually gotten residency. It's never, because when you have your foot in this field, you are going to get through it. Just don't lose hope about it. The number one struggle that people have is that in the United States is that they go through the cycle after, taking their MCAT. They might not get in the first year, but they get in the second year. Same thing with residency. If you don't get in the first cycle again, go through the second cycle, just make your CV stronger. You'll get in. There's no problem. But yeah, if there's try not to take your exams more than a year. That's what I would recommend. How to start research process while in medical school? That is another great question, Fatma. So basic thing is that I've had a very tough time applying for research when I was in Pakistan. But the thing is, know where you want to apply for research. If you're in Pakistan and you find a research opportunity in Pakistan, take it. Make sure it's been the thing that they look for is that, yes, there are programs that require research, you can get it, a research elective can be for 4 weeks to 8 weeks. But I would recommend the greatest research that you could do is if you take a 1-year research paper, because you will be working with different students with it, and that will actually be published. And no matter who you work with, make sure your name is published on that research paper, right? So if you're a medical student, go through NRMP, go through MedPub, look at doctors. There are different websites that I'm going to put it on here as well. There was something with US electives, imgelectives.com is another one. All of these have great programs, but the best thing you can do is go to NRMP, go to MedPub, make sure you find your doctor, and send as many emails as you can. All you have to do, your job is to send as many emails as you can as to different doctors working on research. Eventually, one will reply. Once that person's reply, you're in. You're in. All right. That person replies, you start a connection. If you want to go to the US, then there's different programs for that. They will bring you abroad as well. In Pakistan, they will abroad, but all it takes is writing that email to those different doctors. Normally, they have it in different research websites. They have the doctor's information. They have the email. Do not call them if they have their phone number listed, but just a professional email will get you a long way to start your research. That's all it takes. Emails, connections, mentors. Once you email, you find yourself a mentor and you get interested. If you want ideas, go to NRMP, all right? They will have as many research publication ideas as you want. If you want to start from scratch, you want to do your own research, they will still give you as many ideas as you want. But I would recommend just doing it with a group, you get your name published and you don't have to do all the work. That's all there is. Can you tell as for micro, what should we do? Microbiology? I would recommend BRS is a very good book for microbiology. All I did for micro is I used flashcards from Kaplan and I used Sketchy and Pixarize. They really help in microbiology. I did not use any big books. Sketchy and Pixarize were really good in helping my microbiology concepts, and the Kaplan as well, the video, but Boards and Beyond also teaches you very great microbiology. If you're still in med school, then the best thing for microbiology is, I think it was what was it? Lippincott? Or it was mixed, right? Microbiology and pharmacology, something like that. I don't really remember. But if you want to understand the concepts, then please, it's a 10-minute video. All you have to do is just watch it. And once you watch it, you will understand the concept behind it, whether it's from Sketchy, whether it's from Pixarize, you will understand the concept, and that will let you learn a long way from microbiology. If you want to use books, I would recommend BRS. First Aid gives you a simple concept of microbiology. There's not that many. It's not that hard, but also do as many questions as you can for microbiology. Kaplan flashcards also help, by the way. How much CME credits help for plab or Usmle? When I was in med school, I did take a lot of CME credits for, just for later on. I know in Pakistan, they do help in house job, but CME credits in the United States, they don't help for the medical license exam, but it's just an extra thing you can write on your CV. Another thing, it's just an icing on the cream. So you can write it on your CV and it's a great, application for you. It's another icing on the thing. So it won't help you on the exam, but these credits will just help you on, writing on the CV. You don't even have to take it, but in the end, it didn't really help me as much but it did help people who were doing house job in Pakistan itself. This is a very good question by Zed. Is it true if you delay your step exams? If you delay your step exams, the younger will be preferred over you. Oh, okay. Not necessarily, but yes, do not delay your step exams for more than a year. All right. If you do, then yes, the young substitute will come and take your position. And because they have probably taken their exam in less than a year, and it just becomes harder for you. I'm not saying do not give up hope. I'm not saying that, just quit. All I'm saying is just make sure that you take it under a year, because eventually, it's just going to get harder for you when you apply through the cycle twice or thrice, but it also depends on what you have on your CV as well. Eventually I've known people who've, again, gone through the cycle, maybe the fourth or the fifth time, and a person applying for the first time didn't get it. So that's another thing that you can expect as well. The whole residency thing is all too complicated. It depends on the doctors over there, and connections help a long way as well. Connections, not as in, do not bribe or anything, or just like call in your, uncle or something like that. But that's where, like, if you worked at an elective at that hospital, then they know your work ethic. They might just put in a word for you they'll be like, oh, this person, I know him, he's done an amazing job, he's diagnosed all the patients correctly, he knows the treatment and everything, and his work ethic is great. Then they might take you for that. Will it count if we have done research in other fields, internal medicine, community medicine, but we are applying for a different specialty? Yes and no, Rida. Because if you have done research in other fields, that's great. Like I said, make sure, no one told me this before, but make sure your application is broad. If you're going for general surgery residency, make sure your research is towards that general surgery residency. If you're doing internal medicine, make sure that internal medicine research is going towards that internal medicine. You can pick anything, but just make sure your CV, when you apply to a program, is generated towards that. Make as many CVs as you can, all right? But make sure that application is personally going to that residency program, right? So like if I'm applying for a general surgery program, I'm going to make sure my research is in the general surgery program, and I'm going to apply that CV only to the general surgery program. But on the same time, I'm going to have a medicine CV, and I'm just going to make sure my medicine slides on the other side, and they don't have to tell me where I've applied. I can keep my options broad. When we talk about research, can you guide the difference between authorship and acknowledgement? Yes. Okay, so when I meant about publication, all right, make sure you are in the authorship area. When they publish your paper, when they publish your research paper, you have two different lines, right? You have the main three doctors or the main doctor on the line, and then you have the other doctors that work. Half of the time, they don't give a difference about authorship and acknowledgement, but just if your name is on the acknowledgement and they don't write it on there, they don't write it on the paper underneath the lines. When you look up a research paper, it has all these names, right, on there, and then on the top it has the main doctor's name. You need to make sure your name is somewhere with all those names. Obviously, it's not your own research, but if it is, then go ahead for the authorship. They are going to be very impressed with you if you have your name by the authorship. In acknowledgement, yes, they will still accept you, okay? But do you make sure that your acknowledgement name is published in the research paper? A lot of people go into research, but their name doesn't get published. It's work for nothing. Why would you do that? Why would you work for something when your name is not being published in that? So authorship is more important than acknowledgement, but make sure your name is still there, whether it's an authorship or acknowledgement. Half the time people do not write the names in acknowledgement, which is really, bad. But if they're writing your names, go for it. That's amazing for you. And we have another question on step 1 is now pass and fail. Do you think now IMGs are at a disadvantage? That is a very good question. The main thing that I thought about this is that competition. Basically, they made it, why they changed it to pass or fail? They basically changed it to pass or fail because the medical students in the United States were more focusing on the Usmle exams. They were being more stressed about it rather than focusing on their grades. That's what got them to change it, by the whole NBME committee, by the whole Usmle committee, everything. That's why they decided to change it. I would say IMGs are still not at a disadvantage. Yes, it is harder for them, but the thing about IMGs that are great is that we have enough knowledge to maybe take the step 1 in a month. All right. But we can take the step 2. That gives us more time to focus on the step 2 and give us a higher number when we apply for residency. That might be higher than the ones that, are in the United States. IMGs are already at a disadvantage as where, seats are limited to IMGs per hospital. Obviously, they give more seats out to US medical school students, and IMGs have less seats, but it doesn't mean you're done. All right. It doesn't mean you're really done for. If you still have a high step 2 CK score, you are at more of an advantage than a US medical school student. They will still take you. All right. The other thing you guys need to know is that an influx of probably maybe not this year or maybe next year or maybe the next 2 years, actually maybe the year after or the next 2 years, where there's going to be an influx of IMGs applying because now that step 1 has become pass or fail. That is my personal opinion about this, right? Because now that step 1 is pass or fail, more people are going to start applying, because what was the number one thing that stopped IMGs from getting residency was step 1. People, I know it's hard, but some people would fail step 1, right? And they would get stuck on step 1 and they would go back home or they would go to a different country. Now it's step 2, where I think IMGs have always thrived on step 2, no matter what. We have better clinical knowledge than medical students over here. That's what I'm going to say. What are the top 3 courses a med student should do during or after MBBS? Okay. Top 3 courses. So after MBBS, it is up to you. If you are in Pakistan, obviously you take the NLE and then you take FCPS. I don't know if I said that. I slurred for a minute for some reason, but it's up to you. All right. I know personally people who have taken MBBS and they have done like a master's. Obviously, you can't do a master's here in the United States because, postgraduate studies are after you take residency exams, and then you can, take the courses, specialize in it on that. In other countries, it is way easier to take postgraduate courses. I'm not sure exactly what courses they do take because I'm listing from my own personal experience here. But what I'm going to say is that make sure you do decide what field you want to go through. I've always told this to other medical students, and I've always told this to students that have come to me, is that no matter what you pick, always enjoy what you do. You don't want to live the rest of your life doing something you don't like, and that will annoy you for the rest of the life. I mean, you're making bank, you're making money, but you are gonna, just drown yourself. You're gonna come in, you're gonna be tired, you're gonna be like, oh man, another day. Why do I have to do this? Always pick a field that you've always done great with, that you've always been interested in, whether that's pediatrics, whether that's ophthalmology, whether that's general surgery, whether that's ENT, whether that's family medicine, internal medicine, neurology. Always pick whatever you're interested in. And then look beforehand, is that, okay, I've graduated with an MBBS degree. Now I've got to apply for postgraduate. What are the courses that I need to take for that? A lot of people, if I think postgraduate, I would say is like another maybe 4 years, 3 years. Some are 2 years actually in different countries that I've noticed, but it's worth the journey, right? I'm sorry I can't give more about the courses, but we will list it down below once I do find the information about it. Do you recommend doing proxy researches? That is no, I personally do not, because proxy researches, you never know which direction it might go for you. right? Make sure it is a legit research with a doctor who has published papers before. Make sure that you have talked to the doctor about, showing up. I know someone who was in a research program for a year, didn't really go to that research, but would just say, would just write the information about, during the weekend, would only spend 2, maybe 3 hours a day just writing the information either on Saturday or Sunday. That'd be the best thing ever. And if you're in a group, as many people as you come in, yeah, as long as the name is being published, go for it. All right. What should you do if you want to choose psychiatry in Pakistan after MBBS? So for psychiatry, there is a specific amount of courses, all right, that does go into another thing of postgraduate as well. After you have completed MBBS, apply to the postgraduate programs. There is a great program in Dow University Medical College, OJA campus. Amazing program still. There's still an amazing program in Al Khan as well. But then again, NLE, because I don't think they'll let you choose any program without taking the NLE beforehand, right? And then after you've done the NLE, then you can apply for those courses, right? Then they'll let you choose in. Or you take those courses while doing house job as well. You're getting, information, you're getting practice. House job's not going to hurt you. You're getting a salary on that base amount. And you're also having, let's say, they will also make you rotate in a psychiatry ward. And that is like an amazing opportunity for you because you're also getting exposed to the field. And then you're also taking the courses alongside with that. Psychiatry is totally something different, but if you're interested in it, go for it. I've always, whatever field I was interested in, I've always researched beforehand. We are at a generation where the internet is on our fingertips, right? A lot of people are going to tell you a lot of different things. And unless you research for yourself, then that is the only way you're going to get things right. That is the only way that you're going to go for that. How much time is required for that course? Oh, psychiatry. Actually, see, like I said, the internet is at your fingertip. And I know in the United States, they give you another 2 years to go into that psychiatry field. But in Pakistan, the course is about, see, I'm not even going to lie to you guys. See here. Like I said, in the United States, it's about 2 years. There is actually a 12-month program, CME accredited as well. But if you want to do that after your MBBS in Pakistan, psychiatry is actually rated pretty high in the United States as well. But let me tell you about in Pakistan, since we're all here by each other. Let's see. I know Al Khan University does have it. They do a postgraduate training, and that takes about, so you need an MBBS degree, right? You need a 1-year internship with 6 months in medicine or allied with 6 months in surgery. That internship also helps with house job. See, that's what I was talking about. You need to take your FCPS Part 1 as well, right? And then you can do an internship in psychiatry, which is also house job, or you can do a separate internship in different universities to be eligible for that course. After that course, the course length will take you at a 12-month duration. There is a 12-month one, and then there is a 6-week month, and then there is a 4-week one as well. So it all depends on you. I would recommend going the longer route if you're interested. And what they do in that program is they're going to help you clinical train, right? So basically it happens on a 6-month basis, right? During your first and second years of training, you're going to rotate with 4 consultants on a 6-month basic training, right? After that, they're going to also help you with the research to get you through the program, because if you're in psychiatry, you do need to publish a paper, right? And they are also going to help with on-call duty. All right, what is the qualifications of this? After FCPS, yes, we are also going to do this after us. We're going to do a specific session about this if you guys are all interested in psychiatry, because that's not my field personally. I was just reading everything out to you. But from what I can tell, FCPS is important, right? Getting that internship in psychiatry is important. And then also doing postgraduate in psychiatry is important to be part of a program in psychiatry. That internship may take around 12 or maybe 6 weeks to a year as well. You know, the whole course may take around 2 years depending on where you go again. And next we have what is required to become a demonstrator or a lecturer in US. That is actually a very important question. Okay, so when you're a doctor, you also have to get a PhD to be a lecturer. When you're doing residency, they do get you in as a lecturer to get you a basic scope of everything. But if you want to pursue that route, you need to get a PhD in the field you are going to be a lecturer in. When you have that degree on, well, because you're going to be listed as an MD and a PhD of ... you know, that's how you become a lecturer. But during residency, they also, you know, bring you into classes. They'll be like, okay, this is your day. Come through this day. This is where you're going to teach. And if you want to prepare yourself to becoming a lecturer or a demonstrator in the United States, obviously, visa, get residency, get a PhD, you're in the program, right? That is the main 3 things that you need, and that will set you on a path. A PhD, on how many years it gets from a PhD, I would say I've known people that have gotten their it depends on the field. I've known people that have gotten 2 years. You know, they studied 2 years and they've gotten a PhD, and you know, a specific course. I've known people who've taken a 4-year course as well. Being a doctor is a lifelong process. It's very stressful. It's very lengthy. All right. You won't even have to know, because after residency of maybe, you know, if you're a general surgery, it may take you up to 5 years for residency to be completed. You know, medicine, maybe 2 to 3 years, you know, and then after that, specialization is another, whatever you specialize is another 3 years after that. So again, all this is a very lengthy process. Which 3 fields have the most scope in Pakistan and US, which are highly recommended by your experience in the United States? You guys are gonna have a kick out of this. One thing is neurology has been a very impressive field. A lot of people are going to neurology, and it has been booming like crazy. A lot of people get residency in neurology as well. Another thing, the second one I would say is plastic surgery. Surgery, a lot of general surgery, a lot of people go into, but plastic surgery is becoming another field that people are going into a lot. You know, it's crazy how many residents are going into that, and it's crazy how many you know, students apply for plastic surgery, but they are also getting paid high as well. The third thing, it's not necessarily a field, but people still go into it because the other thing is family medicine. You know, the third field is family medicine. A lot of people get residency in that. That's in the US. A lot of people get residency in family medicine. You know, it's booming. A lot of international medical graduates apply to it, and it's still going along. But an interesting fact that I want to tell you guys is that anesthesiology is becoming a top field in the United States. It's also a very great career if anyone is interested in that, but the thing is, it's also high because it gets paid the highest as well. The last time I did a Usmle session, I had a more of a chart, and I will maybe next time when I come in here, I will share that chart with you when I find it. But anesthesiology do get paid high a lot, and it has also been booming as well. In Pakistan, I would say a lot of people, general surgery. A lot of people take FCPS, they go into general surgery. I know a lot of surgical residents, it's becoming top, and then they specialize into something, you know. After that, you still get a lot of people into family medicine in Pakistan, if not family medicine, internal medicine, because those are like the only, there's more routes in it, obviously, but it goes in. And another third thing is that another third field that I've noticed is that basically on the newest scale in Pakistan is that, because we're having a lot of questions as well, is that, yeah, psychiatry is booming. And I think the most important part of it in Pakistan is because Pakistan is becoming aware in mental health education. And we need more psychiatrists in Pakistan. So that has also been going up in a while, you know. But yeah, those would be my top 3 in Pakistan and top 3 in the United States as well. I guess that's all through the questions that I could go with is how did everyone like the session so far? And have I missed anything that anyone is concerned about? Because I am here to explain my expertise as much as I can. What good fields for females apart from gynecology? That is a very good question. I would not restrict anyone from because females are getting into every single field there is in Pakistan. They don't even have to go into gynecology anymore. You know, a lot of people, a lot of especially friends of mine that are females, they are, you know, HODs. They are in general. They're going into general surgery a lot too, which is epic. I'm really excited for, you know, all the females there are. They're going into general surgery. They are very into it. And that is impressive as well. So you don't have to restrict yourself to one field. Okay. I know back in the day, before standard, they were like, oh, females really do belong in gynecology. That is not the case anymore. The field is wide. All right. I will tell you this, a lot more HODs are more females than males. All right. For every department there is. But specific to your question is, beside gynecology, general surgery, a lot of them are getting to cardiology, which really surprised me, you know. Internal medicine as well. Peds is a good field for a lot of females, but most females do not like peds, which is okay for them, but it is booming in the female business. Hey, and yeah, those are like the major thing. But if you want to go into specific, then cardiology, there's actually respiratory as well, GI. What do you say about anesthesia? What is the scope of this field in USA, UK, and Pakistan? The thing about anesthesia is they earn fast money. And by fast money is that they get paid way quicker than any other field. That's why they raise up to a high amount of salary per year. And the scope of it, I don't know about UK and Pakistan right now, but I would assume in Pakistan, but in United States, anesthesia is really booming. And by booming, I mean anesthesia can also lead to different other fields as well. You don't have to be a specific anesthesiologist, right? But in US, there is a high chance of being sued. All right. The difference about USA and Pakistan is that in US, they do have HIPAA and they do have, you know, HR and everything. And the thing is, there are certain rules where you have a high chance, even though the hospital will have your back and they will assign you a lawyer, but there is a high chance of being sued, and it is the most risky field there is. Because you need to know the right amount of dosage, you need to know what nerve you're hitting, you need to know what muscle is nearby, insertion, origin. But it can lead to other fields. If you think about, oh, I want to do anesthesia, and then you want to switch to a different field, go ahead. Interesting point. I've known people, and a lot of people come for this, is that I've known people who have applied in general surgery, and then they think that their field is not for them, right? There is no time limit to, if you're not worried about money, there is no time limit to change your field, okay? So like, I've known people who have gone into general surgery, and after 2 years of doing it, residency in general surgery, they're like, it's not for me. So they go back into the residency process and they do medicine. Yes, it is lengthy, but like I said, there is no time to think what you enjoy, you know? I've known people that, you know, they are very stressed about money, and they want to, you know, earn money for their family. They want to earn money, you know, to start a family. They want to just have that money with them. And what people do is that, because medicine is a top field, and a lot of people go into family medicine, they apply through family medicine, and then after they've started earning money, then they go back into the residency cycle. Obviously, the 2-3 years of residency that you have, it doesn't count anymore, but they go back into through the cycle, and they apply for a different program that is for them. So like I've always said, there is no time limit of what you do. These are personal people's experience that have gone through them, but it is what it is, you know. Do what you enjoy, and no amount of work, like I said, to able to get somewhere, you need to be able to do the work, you know, no matter what the time limit is. If you don't do the work, things won't come to you. Things will never just approach you in life. You need to be able to tackle it down. And this is what I learned later in life, and this is what you guys will learn too, is that as you grow older into the field itself, you will learn how to manage time. You will learn how to tackle what you need, what you want. And that's what being a doctor is about, you know. Because I'm sharing this information to you, I hope in the future you can share this information to anyone else that comes after you, you know. This is the process. This is what Excemy Medical is about. This is what Dr. Mohsen is about. This is what we have set up. And I won't waste anyone's more time on this. This is the last thing that I'm going to say, is that this information, keep passing it down. You know, there is no competition in the field between doctors and students. Make sure it's a whole community. And as maybe a Muslim, or, you know, being in Islam, it's where you are able to pass down that information. That's very helpful for other people and yourself. You're a student and doctor for the rest of your life. Student and teacher, actually. Can we put things like playing guitar, gaming as extra skills on our CV? Very good question. I would not, because you're making your CV really, you know, a day. Like if you're applying for another job, when you're giving a CV out to a specific job, they only look for the things required for that job. All right. So I would not recommend putting guitar, gaming. I mean, that's good for you, Zed. That's amazing for you if you can play guitar and gaming, you know, that's a great skill to have, but please do not put that on the CV. Obviously, if you're like, you know, like if I'm getting a job at a music store, I'm gonna make sure that this is how I have this many years of playing the guitar. I have this many years of, you know, as gaming, as I give it to a video game store as well. Make sure your CV is pursued to the field that you are going to. All right. These extra skills, I will tell you this, no one cares about it. They don't want to read it. So don't do it. Another thing, because of this question, led me to another thing that you all will find interesting, is that no one will say anything bad about you in a letter of recommendation. I've never seen anything like that. Any letter of recommendations you have, it is good for you. Add it to your CV. but not many residents or residency committee looks at it. That's another thing. Other than that, if anyone doesn't have any more questions, we'll wait for 5 to 10 minutes, and I'll try to answer as many questions in that 5 to 10 minutes, if anyone is here. If no one has any questions, we'll end the session around, what time is it over there? 12:30? We'll end the sessions around 12:30. And then if anyone has any future questions as well on what I've explained here today, they can also watch this video. It will be uploaded onto the YouTube channel. And you can always send Excemy Medical any questions you have through our social media, through our email, through our Instagram, through Facebook. We are always available to help anyone. All right, guys, since there are no more questions, I will be signing off. I wish everyone an amazing Ramadan Mubarak. Hope everyone's fasting is going well. This is Dr. Hamza Farouk signing off, and we will see you next time on Excemy live study session during this Ramadan period every single day. So don't forget to like, subscribe, comment down below what was your favorite part, and also share this as much as you can. All right, everyone. Allah Hafiz, take care, and hope everyone has an amazing day tomorrow, since it's night at Pakistan, or have an amazing night tonight. Allah Hafiz.